Malaria is a disease that is well known to everybody in this nation and especially to the countries along tropical lines. It is treatable and preventable, yet half of the people, especially children under 5 years of age, die from this, as well as those with immunity compromise. In the recent data, out of 10, and I'm very sure this data is wide available, even on Google, you can find it, 3 are malaria admission. This shows that we still have got a long way to go. And sometimes it's scary. Are we going to meet the goal of eliminating malaria by 2030? In response to this, in 2021, the Ministry of Health developed the National Malaria Strategic Plan 2020 to 2025 with ambitious goal of having malaria prevalence and reducing malaria by 80% of 2019 levels in 2025. 2025 is only just barely 2 years away, and we are still struggling. Toward these goals, the Ministry of Health, together with partners, have made some progress. In terms of prevention, we are distributing, as we have heard, in treated mosquito nets as a main prevention. We are also providing preventive treatment for women in healthcare facilities by providing them with Fansidar. It is one of the best ways to prevent malaria for those who are expectant. From community data collected in 2017, 48% of the household population reported having slept under net the previous night. This is some progress. Also, in 2020 and 2021 alone, we have distributed over 4 million nets to the communities, and we hope this year we'll do better than this. With regard to the test and treat approach, we are implementing case management at community and health facilities level. In 2017, the percentage of children who received the recommended anti-malaria drugs when they were sick of malaria was 61%. We are currently distributing malaria drugs to all areas in the country, and we hope all communities can have access. Let me underscore, 8 or 9 states out of 10, plus maybe one administrative areas are underwater. We are also focusing on limited access due to flooding, climate change. So as we said in this hall, we have got additional layer added on the issue of malaria already. Our country, 90% of it is underwater. It is also a blessing in disguise, but we also have to double our efforts. Today, we are in this conference on malaria, the first of its kind in South Sudan. I hope that we can make this an annual event so that we are able to use all the energies in the country to think and research on this disease so that we understand it better, to tackle it better. This is an important milestone, has been mentioned by many. Allow me to thank the Ministry of Health under the technical guidance of the Undersecretary, Dr. George Romanu, all the DGs in the Ministry of Health, the staff of the Ministry of Health and the partners for working so hard to make sure we are seated here today. I recognize all your efforts and they are highly appreciated. As we meet today in this conference, let us bear in mind the following. Malaria is in every boma in the country. Development of health system to control malaria can allow the Ministry of Health to extend the health services in general to all communities. As I mentioned, most of our healthcare facilities are underwater. So I urge our partners and all those who are involved to think of better strategies to actually deliver the nets and the drugs to the communities. Secondly, science has shown us that no one intervention can deal with malaria. We need a basket of intervention, a cocktail of strategies. As we deliberate, kindly take this into this account and be practical about what we have done in South Sudan as we learn about what has worked in other countries. Let us know and understand our communities. They know malaria, and we need to share information about malaria with ourselves, with everybody, and we also need to research better. We have also invited other countries, as we know that there are those who are here among us, and there are those who are attending online. Some are here, as I mentioned, online, and some are here present. We need to learn from them. And also we need to make sure what we learn is in the context of South Sudan. We are not just going to copy and paste. We need to make sure that is what we are learning, what has worked in Tanzania, for example, is it practical in South Sudan with our cultures? Is it practical in South Sudan with our current situation? Finally, we know that malaria cannot just be a business of the Ministry of Health. It needs a collective effort. Developing and sustaining health sector in South Sudan is the work of everybody. It's not only left to the Ministry of Health. It's not only left to those who are dealing in health sector. It is for all of us to win this war against infectious diseases. With this, I wish the best during this conference, and I ask us to learn from one another and also try to make friendship. Maybe some of you, this is the first time we are sitting here today as we work to end malaria in South Sudan. Thank you so much.